Today we will talk about buphthalmos. What's the meaning of the buphthalmos? Buphthalmos meaning that buff means ox and ophthalmia means eyes. So the baby's eyes looks like the eyes of the ox. It's also called primary congenital glaucoma. Primary congenital glaucoma is an increase of intraocular pressure since birth or shortly after, due to developmental anomalies at the drainage angle that leads to enlargement of the eye and optic nerve change. So it's called glaucoma because there is an increase in intraocular pressure associated with optic nerve change. It may be a true congenital condition in which it's inherited as autosomal recessive triad. It represents 40% of the condition. It represents about 14% of the cases. It's due to an increase in the intraocular pressure during intrauterine life. It mostly affects both eyes, but not asymmetrically, which means that not simultaneously. It starts to affect one eye and the other eye follows after it. It also may be infantile condition, which means it appears delayed increase in intraocular pressure, so it appears more late, but not beyond the first birthday. By incidence, primary congenital glaucoma affects more commonly male boys and more commonly bilateral in both eyes and more commonly in the first year of the life. What is the pathogenesis? How it's occur? Primary congenital glaucoma, it may be a primary or secondary to other disease, secondary to infection, infection, or secondary to another associated with another syndromes like Sturge-Weber syndrome. Sturge-Weber syndrome is a congenital glaucoma associated with hemangioma at or along the distribution of ophthalmic division of trigeminal nerve. It's also associated with many syndromes. But primary is more common. There is a persistence of mesodermal membrane that closes the angle of the anterior chamber or iridocorneal angle. This membrane is called Barker membrane. If you look to this picture, this is the angle of the anterior chamber. If there is a remnant or persistence of the Barker's membrane, it will occlude it here and prevents the drainage of the aqueous humor. This is the most common mechanism, but it may be also due to abnormal insertion of the ciliary muscle longitudinal fibers. Ciliary muscle has longitudinal fibers, has circular, has radial fibers. Normally, longitudinal fibers inserted here in the scleral sprue, but in cases of primary congenital glaucoma, it inserted pathologically here. And the trabecular meshwork extends beyond the scleral sprue to be inserted in the trabecular meshwork, and when inserted in trabecular meshwork, it prevents the drainage of the aqueous humor. Then, what is the presentation of a patient with primary congenital glaucoma buphthalmos? We have early presentation and late presentation. Early presentation is triad of lacrimation, blepharospasm, and photophobia. Why this occur? This occur due to corneal edema, leakage of aqueous humor into the cornea, so it irritates the corneal nerve ending and cause blepharospasm, which means excessive and recurrent blinking. The patient tends to let the eyelids closed, and photophobia and lacrimation. But if the patient comes late, it comes with enlargement of the eye, which is the buphthalmos, and hazy cornea and defective vision. We will stop here in the enlargement of the eye. Why only in patients with glaucoma occurs enlargement of the eye? Only if the patient is a child, but not occurs if the patient, as we said, acute congestive glaucoma, there is no enlargement of the eye, because the child eye has an elastic property. It try to compensate the increase in the intraocular pressure by become more elastic, by distend away. Hazy cornea means that it's cloudy, it's opacification of the cornea due to the edema and defective vision. If we look to this cornea, we will notice that there is a lines of haziness. These lines of haziness, this one, and in this picture, this hazy line, horizontal opacity in the cornea is called habeas stria. Also, in this picture, the cornea is larger than the normal, large flat cornea, more than 11 millimeter. The cornea increase in its horizontal diameter. And here, I will illustrate that in an increase in the intraocular pressure, especially here in the anterior segment of the eye, due to increase in the aqueous humor inside the anterior chamber due to abnormal drainage of it, it will affect a lot of things. The first thing will affect it is the cornea. The cornea becomes more enlarged. All the eye becomes more enlarged, but the cornea becomes more flat. Why it becomes more flat? It must be bulged out. Yes, it will be bulged out, but it becomes more flat because the increase in the intraocular pressure all over the eye will cause the sclera to be stretched. So if it is stretched from here and stretched from here, it will stretch also the cornea, and the cornea becomes more flat in the horizontal diameter. This is the first thing. The second thing, an increase in the intraocular pressure will cause these lens to push backward due to the increase in the intraocular pressure in front of it. This is the second thing. Anterior chamber. What about the anterior chamber? Anterior chamber will be more deep. Why it will be more deep? Because the cornea will bulge forward and the lens will push backward, so the space will enlarge. This is a picture of the increase in the corneal enlargement and increase in the horizontal diameter of the cornea. What about sclera? Sclera also stretched and becomes more thin. It will show the underlying uveal blood vessels which have the blue color, so the cornea will be a blue in color. Lens. What about lens and the iris? The lens will push backward, as we said. So this condition is called phacogenesis. Phacogenesis means that the lens becomes more mobile due to its pushment or its subluxation of the lens. Iridogenesis means that this iris becomes more movable. Means that is the vibration or agitated iris motion with eye movement due to lens subluxation. Normally the iris lies in the lens, so it is less mobile. When the lens pushed backward, it becomes more mobile, and we call it iridogenesis. Or we call it tremulous lens. Anterior chamber increase intraocular pressure will cause that, as we said, enlargement of eyes in all directions. So the eye becomes more large than the normal eye. As we said in the video of myopia and hemimetropia, that myopic patient has abnormally large eye. So that the picture will tend to be in a point in front of the retina because the eye enlarged more than the normal. So we expected that because the eye is very large, it will cause a high myopia. But in cases of ophthalmos, it causes a minimal myopia. Why? Minimal myopia caused by the compensation between the effect of hypermetropia and myopia. Myopia caused by the enlargement of the eye, but hypermetropia caused by the effect of the increase in intraocular pressure in the lens and the cornea. How intraocular pressure affects the refractive power of lens and cornea? It affects them by decrease the curvature. We said that the cornea becomes more flat and the lens pushed backward and becomes more flat, so the refractive power of them becomes more less, and the object tends to converge in a point beyond the retina. So there is two powers, the powers of the hypermetropia and myopia, and the result is a minimal myopia. How we can, before the treatment of these conditions, we will talk about the hazy cornea. Hazy cornea is caused by the rupture of the Descemet's membrane and leakage of the intraocular aqueous humor inside the cornea. So the cornea will appear cloudy and hazy. Treatment. How we can treat a condition of primary congenital glaucoma or buphthalmos? We treat it according to the presentation. Is it early or is it late? If the condition is early, that means the diameter of the cornea is less than 13 millimeter. If the diameter of the cornea is less than 13 millimeter, we will treat it according also to the cornea, if it is clear or it's hazy. If it is clear, we can see through the gonioscopy, and we do goniotomy. We enter and we move this membrane, which is called Bark's membrane. But if it is hazy cornea, it is unclear. We cannot see by gonioscopy. So we do trabeculotomy. We open the trabecular meshwork and allow the aqueous humor to drainage through it into the canal of Schlemm. Because in early cases, canal of Schlemm is patent. But if it is a late cases, the diameter is more than 13 millimeter horizontal diameter of cornea, and the angle of Schlemm becomes atrophic. This use atrophy of the canal of Schlemm. So there is no chance to do goniotomy or trabeculotomy because there is no way to the aqueous humor can pass through. The only treatment is to do external fistulization. External fistulization means that we create a new pathway, another than the atrophic canal of Schlemm, to the aqueous humor to pass through. Like here, this is the ciliary body where producing of aqueous humor occurs, pass through the angle of, pass through here and to the subconjunctival space, drains through it into the venous system. Also, this is a picture which represents the extra pathway we created, external fistulization. What is the role of the pharmacological treatment in these cases? Pharmacological treatment used only for before surgery to decrease the intraocular pressure. We can use acetazolamide, which is called Diamox, to decrease intraocular pressure before the operation.